Many of us are familiar with the symptoms of anxiety: overwhelm, panic, racing thoughts, even things like nausea and dizziness. And if you have thyroid issues, those symptoms can become much worse. The thing is, if you've already been prescribed thyroid hormone and you go in to see your doctor asking if your anxiety is related to your thyroid but your labs look normal, they'll tell you it's from some other cause. Although it's certainly possible to have more than one health issue going on at any particular time, in today's video we are going to cover the 3 reasons why you're having thyroid-related anxiety even if your lab tests look normal. If you want the best information when it comes to naturally supporting your Hashimoto's and your thyroid gland, make sure you subscribe to my channel and ring the bell. That way you'll be notified when I post a video every single Thursday, and I don't want you to miss any of the great content. My name is Dr. Bodle, and over the years I've helped hundreds of patients with thyroid issues improve their energy and lose weight naturally. But one of the other parts of the body that is directly linked to thyroid function is our brain, and it's very common for people with thyroid issues to have symptoms like anxiety. So let's start off talking about the first reason why we can have thyroid-related anxiety symptoms, and that is inflammation. The number one cause of low thyroid symptoms in countries that have enough iodine in their food system is Hashimoto's. Hashimoto's is an autoimmune thyroid condition where our immune system starts to attack the proteins and enzymes in our thyroid gland, preventing it from being able to produce normal amounts of thyroid hormone. If you want to learn more about Hashimoto's and don't know too much about it already, make sure you check out this video that I made where I cover all the basics that you need to know and things that your doctor hasn't covered with you already. But the main thing for us to understand is that when those autoimmune attacks occur, they are breaking apart cells in our thyroid gland, and anytime we have cellular damage, it leads to inflammation. It's the body's signal that something is wrong. An easy way to think of this is if you've ever sprained your ankle, you'll know that it'll get swollen, red, hot, and painful. That's inflammation occurring because you have torn or damaged the soft tissues in that particular ankle. A similar thing is occurring with our thyroid gland, except it is related to the immune system activity rather than a physical trauma. One of the key differences between the inflammation in your ankle and the inflammation in your thyroid is thyroid inflammation circulates the body. It's not like the ankle sprain where that inflammation stays local to the injury. When that circulation occurs, one of the areas that it can directly impact is our brain, and our brain does not do well when there are increased levels of inflammatory cytokines. One part of our brain that is particularly sensitive to inflammation is a part of our brainstem called the mesencephalon, or the midbrain. Now, I won't test you on the spelling of mesencephalon, but what it is important for you to know is that this is the neurological origin for our stress response. Once our mesencephalon becomes activated, it communicates with higher parts of the brain, letting us know we need to be aware and on edge. And it also communicates with our adrenal system to increase the level of stress hormones, things like cortisol and epinephrine. The best way to think about how our mesencephalon works is imagine yourself walking down a dark alleyway. Every little sound, every little movement is going to catch your eye, and it's going to send your heart rate skyrocketing, your breathing will increase, and you may be ready to scamper on out of there as quickly as you can. However, being in that dark alleyway is situationally based. We want to have a stress response when the scenario demands it. But what if, instead of dealing with an external trigger, we have internal physiological and inflammatory changes which are driving that stress response and anxiety? Well, that's the exact scenario that can play out for people with Hashimoto's that is chronic and unmanaged. The continued activation of their immune system damages the thyroid gland. That leads to the spilling of inflammatory markers into the bloodstream. This then activates our brain and mesencephalon, which drives up that anxiety. That means the better job that we can do at limiting inflammation in the body and supporting our immune system, the better outcomes we will have in terms of those neurological symptoms. Reason number 2 why we can have thyroid-related anxiety symptoms is due to a phenomenon that we call cross-reactivity. As we said before, the number one cause of hypothyroidism is an autoimmune condition called Hashimoto's, and the hallmark of autoimmunity is the development of antibodies. Now, antibodies are proteins that our immune system makes to help defend ourselves from infections like bacteria and viruses. and they have a specific shape to them that allows them to identify a particular type of pathogen. In the case of Hashimoto's, instead of antibodies being produced for a particular shape of a bacteria, they are instead binding to the enzymes in our thyroid gland, and those also have a specific shape to them. Interestingly enough, there are proteins in our brain that have a similar amino acid sequence and therefore a similar shape to those enzymes in our thyroid gland. Since our immune system is all about shapes and finding the right fit, those antibodies that will attack our thyroid gland can also fit or attach to the proteins in our brain that look or are structured in the same way. This is cross-reactivity. When our immune system makes a particular antibody for a specific protein or enzyme, and it doesn't have to make a new one for another part of the body, but because they are so similar in their shape, that antibody can actually fit to both, we can see damage in both of those areas. In particular, the part of the brain that can be affected by thyroid antibody cross-reactivity is called our cerebellum. In general, our cerebellum coordinates movement and stability. And when we have increases in immune activity, it can cause this part of the brain to not function as well, and people will notice symptoms like dizziness, vertigo, nausea, and maybe clumsiness or having trouble with their balance. The thing is, our cerebellum actually has direct connections to our old friend, the mesencephalon, the stress part of the brain. And if our cerebellum becomes overactivated by things like our immune system, then it will talk to our mesencephalon and drive up that stress response. So if you notice that your anxiety goes along with a lot of those classic inner ear symptoms, like the dizziness and vertigo, like the nausea, like the balance issues, then there's a high likelihood that this is coming from cerebellar dysfunction as a result of the immune system activation. Now, those are some pretty big topics and they can get a little complicated. So if you have any questions, make sure to let me know in the comments below, and also share with me if you think that some of your anxiety symptoms might be related to your thyroid, but that connection just hasn't been established yet. The third and final reason why you could be having thyroid-related anxiety symptoms is excess T3 in your system. If you don't know, T3 is the more active version of thyroid hormone, and we have to convert T4 into T3 to drive the majority of our metabolism. There's two main ways that we can have excess levels of T3 that can actually drive our metabolism to the point where we can have inward trembling, racing thoughts, and we can't manage our stress like we would like to be able to. The first is caused by medication. Now, a lot of people these days are asking to be switched from a synthetic T4 medication like Synthroid or levothyroxine to a T3, T4 combo medication, things like Armour or Nature-Throid. Now, for people who have issues with thyroid hormone conversion, changing that T4 into T3, having a combo medication can help them a lot. A little extra T3 when they don't do a good job of producing it can go a long ways in terms of how their symptoms respond. That said, some people can't deal with any amount of active hormone being directly added to the body. There's a reason why most of our hormone is in that T4 state, and sometimes medication can overdrive that conversion pathway, leading to negative symptoms. The second way that we can get excess T3 levels is due to that autoimmune activity that we discussed before. When our immune system flares up and damages the thyroid gland, it breaks apart the cells that actually hold T4 and T3. When this happens, instead of a nice easy drip of thyroid hormone into the bloodstream, we get a bunch of hormone that becomes spilled out all at one time. So you'll notice if you're going through that traditional autoimmune pattern where you'll have times where you're feeling good and also times where your symptoms will flare up, you may be able to correlate the increase in fatigue, hair loss, and weight gain with an increased level of anxiety. That's because when our damaged thyroid gland is not giving us a consistent supply of thyroid hormone, it leads to excess in the blood that we cannot tolerate, driving up our symptoms. So to review, the three reasons why you might have thyroid-related anxiety, even when your thyroid levels look normal, is because 1, you may have elevated inflammation associated with autoimmunity. 2, you can have thyroid antibody cross-reactivity that directly impacts our brain. And 3, excess levels of T3 either from medication or from autoimmune flares, can oversaturate our bloodstream and cause the negative anxiety response. If you're looking for more natural ways to support your thyroid and improve your anxiety, it can be very difficult to know what you should and shouldn't be eating. To help you out with that, I created a free download titled 109 Foods to Boost Your Thyroid and Support Your Energy, and you can check that out at the link in the description box below. That's all for today's video. I appreciate you watching and I hope you enjoyed the content. If you liked it, make sure to give it a thumbs up and subscribe to the channel. If you're looking for daily tips and tricks to better support your thyroid, you can check me out on Instagram and the link for that is in the description box below. My name is Dr. Brad Bodle. I hope you're all doing well, staying healthy, and I'll see you guys soon.